Greetings, listeners, and welcome to the Care Table podcast, dedicated to educating and supporting family caregivers of aging loved ones. I'm your host, Amy Huddleston. Through insightful interviews from both industry experts and family caregivers, we aim to provide valuable perspectives and resources. Let's see who we're learning from today. Welcome to today's episode of the Care Table. Before we start, I want to remind you, please like, subscribe, leave a review for us so we know how we're doing. Today is going to be a pretty heavy topic on the emotions of caregiving. I think this is a great one. We probably could talk for about 5 hours, but we're going to try to not do that. We're going to try to focus on just some tools that we could give to caregivers and also people that might be receiving a diagnosis of dementia. We're very fortunate to have Amy Luba with us. She is a social worker who has her own counseling business. She's got a dual master's degree in both public policy and social work. She's been in this industry for quite some time. So we're very fortunate to have her knowledge to learn from, her experiences and what she does for a living. So Amy, I'm going to have you just start by just give us an idea of how did you get into this industry, and what made you decide you wanted to go to the counseling route?
Yeah, thanks, Amy. Thanks for having me, on your show today. I'm super excited about this. So my journey and how I ended up stumbling in this path. I do have a dual degree. I did some work with the legislature and policy. And, like all of us women, sometimes we make this journey into motherhood and we try to figure out what we're going to be doing. And working for state legislature at that time was just not going to be doable for me and my family. So after I had my two daughters, I decided to, and was fortunate enough to stay at home for a few years. And then I really wanted to get back to work and do something, and I couldn't really figure out what I wanted that to be. Of course, looking for that flexible schedule and all. So this would have been 20 years ago, 18, 20 years ago, I started with Ohio Health Home Health Care. So they provide skilled in-home services to, in Central Ohio is basically where we covered. I worked alongside a team of amazing physical therapists, occupational therapists, speech therapists, home health aides. And I was that social work branch arm of that team. And we would, go into homes, and I was there to meet with families, a lot of times in that resource capacity. I became very interested in patients that had dementia. It was challenging for the team to work with someone that had a hip replacement and also dementia, or, a knee replacement and some mild cognitive impairment, or it was someone with more moderate dementia. The family did not know what to do. The primary care doctor orders in-home skilled therapy to try to work on med management, to try to work on speech therapy, which is not just how we articulate words, but it can be for cognition and memory, recall exercises. So speech would get added. And then I often got added to the team in a focus in terms of figuring out resources for the family, figuring out resources for the caregiver, providing some dementia behavioral intervention techniques. And that ultimately is where I learned a lot of hands-on ways to work with families. It was challenging though, because I just witnessed firsthand the stress that caregivers would go through, the long-term needs that exist for the patient with dementia and the caregiver, and the short-term capacity of skilled home health care. And I often had to leave these families after their insurance, their skillable time was up, which is not long. And if you have dementia, you can't retain exercises. You can't follow through sometimes with what the therapy team is doing. So it makes it even shorter in terms of the team being able to stay in and for it to be skillable. So, those long-term needs of families just continued well beyond our capacity. And I greatly struggled with that. I worked for Ohio Health Home Health Care for about 10 years. I then worked for a geriatric care practice and worked alongside some geriatricians where, they did memory assessments. And again, I was back in a role working with caregivers and families, but from an office capacity. So I was no longer going into homes. So that changed some things. And over the pandemic, I just want to mention that I saw a huge lack of agencies that could staff aides and support the need in the community, and then way too many respite day programs that closed. So there was this gap that happened simultaneously as I was making that transition. The program that I worked for suddenly closed, and I was left with the daunting task of trying to find referrals to other counselors, to other social workers for about 300 patients. It was very challenging. The shortage of skill in the community in working with persons and families on the dementia journey is significant. And lots of times, if in that psychology world, psychologists, social workers, licensed clinical practitioners prefer a neuropsych assessment on someone that has dementia or mild cognitive impairment. And that's not possible, nor is it necessary for those that have already either had a diagnosis or even early on. Those neuropsych assessments are 4 hours long. And while the data can be valuable for some, it is nearly impossible to put someone through that extent. And I kept hitting this wall of making referrals, and they'd say, well, they need a neuropsych, first before the referral. And so I decided to take a leap, and I started up compassionate counseling for seniors and caregivers 3 years ago, coming up on 3 years ago. And it's going well, and the referrals keep coming because families need help, and it is hugely overwhelming to try to first get a diagnosis, because sometimes that can take a couple years even, right? And then once you get the diagnosis, how to deal with kind of being, slapped with a diagnosis on your back and led outside of the office to then do what, right? Like, how do we process that? And that's when I typically hear of families, caregivers, clients, reaching out to our practice.
I mean, what a void you are filling. I'm fascinated by that story. Couldn't agree more with you, because even though you were in the home health industry, I was in the non-medical home care.
Yeah.
And I was I'm very surprised, I think, at the lack of training that exists. I even saw it in facilities. I couldn't believe when I would see the staff that work in facilities not really understand how to communicate with somebody with dementia, how to patiently manage them, whether, when you're transitioning to, let's say, go down to get something to eat or going to the bathroom, and they weren't taking the time to, just acknowledge this person is afraid, or they're scared, they don't know what's going on, so let's take some extra time. I was really flabbergasted at some of the things that I saw, and I really can't agree more with you that there is a huge void for families that, right, I was envisioning just what you're saying. If you walk out of the doctor's office and you just got this very difficult diagnosis and you're saying, I don't even know where to start. And I mean, it's really an amazing thing that you started to say to families, hey, I'm going to be here to just listen to you, help you process what you're going through, and just help you navigate that. So let's dig a little bit into, now that you've got this counseling service going on, give us an idea of the estimated breakdown of your clients. Like, the type of people that you're servicing. Are they more caregivers? Are they more people that have received a diagnosis? Let us know kind of that breakdown.
Yeah, yeah. So there's actually three of us. It's myself and Alan Meisterman and Aaron Webb. So there are three of us in that counseling capacity. We are all licensed independent social workers, referred to as LISWs. The I is important because it means we can bill insurance, and we really want families to have that option available to them. While we're not contracted with all insurance companies, we are with some, Medicare being a big one. Our mission is to support older adults, caregivers, and families navigating life's challenging transitions. Um, and we focus on providing counseling, guidance, advocacy, walking alongside them through life's transitions. One of which being that dementia journey. And about half of our practice, nearly 50%, are caregivers themselves. A lot of spouses. Majority of that, I would say, is spouses. And then we have some children that reach out to us. Mom's just been diagnosed. We're all overwhelmed as a family. Um, and then the other half tends to be a mix. We do have a handful of clients who they themselves have been diagnosed with a form of dementia, right? Like the dementia umbrella. And then there's all different types under there, Alzheimer's being one, frontal temporal dementia, Lewy body dementia, even Parkinson's, Huntington's can have those, dementia secondaries too. So it can be challenging for those that get diagnosed that are early in their stages of dementia and having to process that. Anxiety and depression are very common. Think of ourselves if we're diagnosed with any medical condition that feels permanent, just anything, right? Just think of anything, right? Maybe it's a kidney disorder, maybe it's Crohn's disease, maybe, it's cancer, right? Like, and then maybe it's dementia, right? And so we're trying to process that. And someone getting diagnosed with dementia, especially in that early stage, they're processing that. And it's very fearful, and there's a stigma that comes with dementia that doesn't necessarily come with any of those other medical diagnoses, right? It's they're going to go crazy. They're going to forget everyone around them. Do they even know who I am now? And what really, I'll just say, sucks about that part
Mhm.
is that you get tested by everyone around you. So everyone's looking for what is compromised instead of what remains. And there's still so much that remains. So our practice tries to hold hands with whether it be the caregiver or the person with dementia, to walk alongside them, to be in that you are a person first before you are a diagnosis. You are a spouse, a husband, a wife. You are maybe, a mother, a father. You are a sister, a brother. You're a neighbor. You're a friend. You're a volunteer at the food pantry. Like, you are a member at your church, and you are all of those things before you are your diagnosis. And that is one of the first steps that we take is that person first language and thinking, even for caregivers, right? Like, reminding them their husband is still all these things. We don't know when some of that's going to become compromised or faded, but that term mindfulness that we all need to work on, right? Like, the term mindfulness exploded, like it was like 2008. I think there was a lot of, that's when the term mindfulness came out. What does it even mean to be mindful? Then during the pandemic, we all checked ourselves in terms of, I think I'm losing it. I need to get outside. I need to get back to nature. I need to go for walks. I need to, I'm wearing a mask if I go in the public. I don't like doing that. Who do I talk to? Can I go in people's homes? I don't want to go too far on that pandemic part, but we all, and if it did anything for, the world, is that the focus on mental health is absolutely critical. And mental health and physical health are all of one, right? It's not our physical health and then, oh, by the way, how's our mental health, right? Like, it is all part of a whole person perspective. So mindfulness is staying present in the moment, which we absolutely cannot do all day long as human beings. Our minds will drift. Just as everyday normal cognitive people, we are thinking about our grocery list. We are thinking about, what tasks we have to do next. We are thinking we are tired because we didn't sleep last night. We're thinking about what to do with the kids. We are thinking about, in retirement, where we're going to be volunteering next, who we're going to be going to lunch with, what we're going to do to spend our days. We all are thinking about our next move. And if we have depression or anxiety on top of that, then we're stuck in a lot of negative thoughts, right? We reflect back on guilt, regret. As we age, we do a lot of life review when we get to a certain stage. And I see that life review happen at retirement age. Well, when do people end up getting diagnosed with health conditions as we age, right? Around retirement age sometimes, right? It throws a wrench in what we're feeling, our view and our goals are for retirement. So there's just a lot of this going on. So helping caregivers and helping persons with dementia be mindful, be more present in the moment, right? Thinking about what they have right now. Um, I'm going to mention some books, and I can kind of go over this as we go through this maybe towards the end, but there's one in particular that I absolutely love, and it's Finding Moments of Joy by Jolene Brackey. I love that so much for a few different reasons. It gives specific examples, messy, frustrating, grief, memory compromised examples that feel yucky, and how to find a moment of joy in that. And it gives real life examples. And what I also love about it for caregivers is that it has this wonderful index where you can go through and be like, how do I tell my spouse they can't drive? Or what about driving? What about, not being able to remember, granddaughter's name? What about like not being able to, organize a meal plan? What about placement? There's all these, and the index is really awesome because you don't have to read I'd recommend that, but I use it as a reference where I can just kind of flip back and read through some of that with families. And it helps to pull out ways to find that moment of joy. We're natural negative thinkers sometimes as human beings. We get a medical diagnosis, we go negative, and we fall down, oh Lord, that rabbit hole of the internet, right? In looking and researching what the diagnosis is. And I'd caution people about that because you get a boatload of information. A diagnosis is a diagnosis, and every human body is different. If I've seen one person with, dementia, whether that be FTD, Lewy body, Alzheimer's, I've seen one person because they all look different. And while it can be scary to hear about further advances in the disease and what caregivers go through, I like to talk with families about this doesn't mean this will be you, but know that there are resources at this stage, as you're moving through this. Um, yeah, it's
That is, I mean, it's just so heavy, but I couldn't agree with you more that I think there's always a silver lining. And it's really about your mindset does truly matter, how you're handling these things. And if you can focus on, like you're saying, there are moments of joy. There are, I have a friend that I'll share, dear, dear friend who just suffered a stroke and she's way too young. It's been very hard to watch, but what I notice though is I'm amazed at the community that's come together to support her and help her. So I'm focusing really a lot on, instead of, the things that are so hard and sad right now, I'm focusing on, wow, I'm a little bit in awe of these people that have stepped up and all these people that are working together to help. And so there are moments of joy that you just realize, that who your true friends are, and your family, and just what people's strengths are, and how they can help in these really challenging situations. So when you're working with, whether it's the actual person that's received that diagnosis or the family, give us some examples, and it's probably different, I would imagine, on what are some of the tools that you're recommending that they're the way that they can process some of this. And um like you're saying, what are the tools that maybe you're saying to them about being mindful? What are some of the things you could share with us about that?
yeah. So the number one way for us to be mindful that is the easiest to access, that we get the greatest benefit from, all of us, everybody, is our breathing. And I know that sounds so basic. We never think about it. We do it, subconsciously. It's just, automated, right? But we also get into this shallow breathing where we're not taking a full deep breath. And when we are stressed or when our cortisol spikes, high, which as a caregiver, our cortisol, that hormone, when that's elevated and we're constantly experiencing these stressors, um, that's not good on the body. We know diseases happen. Um, in terms of our health, right? We know that healthy eating and exercise is beneficial, but even more importantly is controlling, right? Our stress and bringing down that cortisol level. Well, 5 deep breaths, inhale, exhale, and really like expanding our lungs, deep belly breathing, exhaling, getting squeezing one last breath out, right? Just really trying to get some clean air back in, like just thinking about our breath. When we start to feel ourselves, and in working with caregivers, a lot of times, Amy, they're not able to recognize what necessarily sets this high level cortisol, right? They know when they get there, but it's seeing that it's coming and doing something in between so they're not constantly hitting their head against that cortisol spike ceiling, right? Um, our breath work can take us there. There's beautiful ways to breathe. There's box breathing. That's another really good one. That can be really good. Just, visualizing a box, inhaling and exhaling, kind of to get ourselves from one point corner of the box to the next point, right? There's 4-7-8 breath. That's a really popular one. You'll hear yoga instructors talk about that. You will hear, a lot of counselors talk about that. Anyone in the wellness community, 4-7-8 breath. So you breathe in for the count of 4, you hold for the count of 7, and you breathe out for the count of 8. And a lot of times just doing that one time, it's like we can feel it into our fingertips and toes. I don't know how else to kind of explain that, but I'd really recommend that we find our breathing. And some of those breath work exercises are really helpful to know that we're slowing our breath down, right? Um, any of these breathing exercises, doing it 5 times, studies indicate can improve our attention, can reduce our anxiety, can reduce our irritability, and can reduce our emotional reactivity. Now, having said that, that does not mean you're good all day because you did your breath work in the morning, but it does mean that it's a tool to use. I often will tell caregivers, combine it with your meal times, right? Because then you're at least doing it 3 times a day. It's trying to remember to do it. And it's not something that we have to continually remember all the time. It actually will start to become almost rote for us that we feel ourselves stressed and spiking in our cortisol. And all of a sudden we notice we're going, and here's the beautiful part of breath work, Amy, is that it can be contagious. So sitting next to our loved one with dementia and doing deep breathing, try it. Like they're going to do it too. Do it sitting next to your teenage kids. They might do it as well. Like it becomes, you start to do it when you hear other people do it. A very simple tool.
It's an amazing tool. I was going to say, I've noticed, I have my watch that tracks your heart rate, and you literally see your heart rate slow down when you practice that deep breathing.
Isn't
It
it
really
amazing?
works. It's amazing. It's just kind of I don't know if you saw the show Limitless with Chris Hemsworth, but I want to say it might did you yeah, the first episode is fascinating because he's in this extremely stressful situation and the doctor teaches him, okay, you're just going to practice deep breathing, right? He's not given a medication, he's not given an oxygen mask, he's not given anything else, but you learn how to breathe deeply and it works and you're just blown away. So I agree with you that if you can stay mindful of maybe if you find yourself in that moment that you're starting to get a little bit anxious too with whoever you're caring for or a situation you're in as the person with some memory loss, just take a moment and
Yep.
breathe. And it
Yep.
really, really does help. So I think that's really fantastic advice. Are there any other tools that you would recommend when people are, like you're saying, their cortisol is getting a little high, or they're just feeling like, how do I cope?
So for caregivers, when they initially, come to see us, we always recommend that they maintain something that they like to do. Don't stop your hobbies. Don't stop exercising. Don't stop playing pickleball. Don't stop playing mahjong. Um, don't stop going to lunch with friends. And I know I say that, and it's, as a caregiver, you're like, well, how do I do all of these things? It is equally just as important as doing something for your loved one with dementia. You're helping, if we start with kind of early stage, right? You're trying to do activities that you both enjoy. You're trying to enjoy the community together, and that sometimes goes rough. Socially, it can become compromised, right? That social inhibition, where you and I know how to be as socially appropriate in public settings, but someone with dementia and some early signs may not have that filter. We are becoming compromised in our what we're able to inhibit, right? Instead, we just kind of exhibit, right? And that can be hard. Um, Equally, though, you need to do something for you as the caregiver, and you need to have your little bit of normalcy in your life. So if your life involved you playing pickleball, you playing mahjong, and when you do those activities, you are mindful, right? You're present in the moment. There's no worry about the future getting in. There's no regrets, guilt about the past coming up, right? So you're focused, and that's mindfulness, right? Like that's what we're trying to do with ourselves. Exercise gets us there, not to mention it helps our health, right? Um,
Mhm.
Gets all of our, digestion going. It helps our central nervous system. It helps our vagus nerve, just like breathing does. So, exercise and movement is really amazing. And you can even, kind of juggle it, right? Like I'm going to play pickleball, Monday, Thursdays, and then Tuesday, Fridays are when me and my husband will go to the park and walk, right? Like you're looking at exercise for them, and you have to look at exercise for yourself.
Mhm.
So it's trying to keep ourselves important as a caregiver in what our self care is, as well as this new role as a caregiver and what that means. And it's a journey that we have to hold hands with, both self care and providing care. And it's hard.
So hard. That's really to figure out that balance. Let me ask, if, let's say I'm the family member. So maybe I am the daughter or the
Mhm.
son, or I'm the niece, or I'm a good friend. What's the best way I can be supportive of a situation where it's somebody that I love is caring for someone that I also love? How can I be helpful in that situation?
Listen, be a good listener. Um, Recommendations um, can be hard for a caregiver to swallow. It can be overwhelming. Being a good listener, giving that caregiver space to vent about what's going on, giving the grief a chance to come out, right? Um, and it's also really important that we're not saying some of these things that are not helpful whatsoever, like these common 10 things, that you should not say to a caregiver, right? We don't want to put a caregiver on a pedestal, like, and say things like, I don't know how you're doing this, or you are a saint for doing this. They don't know what else to do. It's not really a choice, they're just thrown in this. Another statement that I hear a lot, that caregivers will say they hear a lot, is, let me know if you need anything. that's not really helpful to say that. It's common language, Amy. You and I say it too. We say it to friends. Let me know if you need anything. The problem with that is that it's not actionable. It puts it back on the caregiver to come up with something for us to do. Having actionable empathy goes a long way. So instead of saying, let me know if you need anything, or if you catch yourself saying, let me know if you need anything, follow it up with, how about I bring lunch over tomorrow? I'll just drop it off, or I can stay an hour. Don't even have to know if I stay or not, but I'm going to drop off lunch, right? So you give them this window, or hey, how about I know that you're always dropping off the dry cleaning. I'm dropping mine off too. Let me pick yours up. You know, um, how about we go for a short walk, 15 minutes. Saying something that takes a small amount of time might help to get their buy-in. You know,
So be specific is what you're saying. Be
be very
specific with what I'm offering to do, not just saying, I'll do, whatever, let me know. So basically saying I'm going to drop off dinner on Friday
absolutely
and are there any dietary restrictions? So maybe just ask that question and then, okay, so I'll drop it off at 6 o'clock. Okay,
sure.
great.
And
Okay.
that's a comeback. So that's a comeback for when you might say, "Hey, let's go grab lunch," right? And the caregiver has not gotten to a point where they're able to juggle, um, maybe how to do that. Maybe their person, and a lot of times it's spouses. Maybe their spouse. It's questionable on whether or not they can be left home alone. That is a tough seat to sit in. Um, So they're not sure if they should leave, and they haven't brought care in yet. Okay, that leads me to another thing that we should not say to a caregiver. You're going to need to hire help. What are you going to do when this gets worse? Um, are you going to place them, which is something that gets said to caregivers early on? They're not there yet. They're still processing the diagnosis. They're still having to navigate their day to think about this. They're working through, their anticipatory grief of, not knowing when this ends, but it feels like it ends sooner, right? In terms
Boy,
of
that's a
feeling
that's a
safe.
big term. So explain
Yes.
anticipatory grief. What do you mean by
Yes.
that?
And that is a big one. Anticipatory grief, it's like we know it's grief, or at least we think we know. Sometimes we're experiencing these feelings and unable to recognize that that's what we're feeling. Um, so there's not a funeral. There's no casseroles coming to your door. There's no one celebrating the life that you've had together. These are all things that happen when someone dies. Your person is here. So it feels very uncomfortable to live in that end stage, right? But it's coming, but then you don't know when. Um, and that part gets really hard because you know, we experience grief. Maybe if I can sum it up, like four different really critical points along the journey. And that might be when you first notice your spouse or loved one not remembering things they used to, or there's some red flags coming up, right? That gets to be worrisome. But then you get the diagnosis, huge grief at that point. What does it mean? How long will my person be living? When is their end of life? How long do I have before they no longer recognize me? That's a huge one that I get. Not everyone with dementia, Amy, loses the ability to know their family. Don't. Even if they lose the ability to speak, you can still see their eyes light up when their person walks in the room. So I want to throw that out there because there's a huge stigma and assumption that everyone with dementia loses the ability to know their people, and that's not what I have experienced or seen, and that's not what studies indicate. Yes, it does happen, but it doesn't happen to every single person diagnosed with dementia. So we have to be really careful that we're not living in the world in which they've forgotten us or are going to forget us, right? Because it takes us out of the present moment. We're not being mindful. It takes us out of
Unbelievably good advice.
control.
It does. Like that is so, and I will actually agree, I 100% agree with you because in the 20 years I worked in the industry, you're right that they don't all fit in the same bucket. I mean, we had some clients that had very advanced dementia and were still pleasant as can be and smiled and recognized their spouse. And they may not call the spouse by their right name, but they absolutely were, they knew that was their safe person. That was
Yes,
the person that they felt most comfortable around. And then of course you get different situations, but that is phenomenal advice for people to understand that you shouldn't, even though I'm sure it's extremely hard, you shouldn't jump to this stage where you feel like this is where I'm going to be and I don't know when, because you don't really know that. So
right.
I agree that you're back to that
Um,
mindfulness of let's just stay
so
in this moment.
absolutely. So in terms of like these four trigger points of grief, right? So that point of diagnosis, and then the next stage I would say is when a caregiver needs to figure out how to get help in the home because that feels really overwhelming. And then um, and you can kind of combine and placement. Placement is a huge trigger for grief. For those that have need to consider placement, that's a really really tough step to take. And then hospice, right? Hospice is a resource. Um, Hospice is not that program that, 15, 20 years ago, hospice comes in the last 5 to 7 days of someone's life. And they're just there, to help someone um, remain comfortable and cared for as they die. Yes, that is a beautiful part of hospice, but that is not all of hospice. Someone with dementia, depending on where they are in their stage of dementia, there's a lot of different scales. I personally like the functional assessment staging tool, the FAST scale, right? So when someone gets to be that in and on that particular scale, like 7C, 7D into the sevens, which is the last number of the scale from 1 to 7, they're generally going to qualify for hospice because no one knows when this ends, right? You could ask 5 different geriatricians, neurologists, and hospice staff, right? Like, and as long as you have a physician that is willing to say to their best medical degree of certainty that this person has 6 months lesser life, right? They can qualify for hospice. Well, I have some caregivers whose loved ones have been on hospice, for 12 months, 18 months. Sometimes they graduate off of hospice because they maintain, right? For longer than what was anticipated, but it's a resource, but it's a grief trigger as soon, I mean, of course, the term hospice, it's the end, that just comes with that terminology. So that's a big trigger. And then ultimately it's the grief that society knows of, and it's the grief that the person has died. When we think of grief, we think the person has died, you know, but it could be years from the point of diagnosis to the point that they die. So it's this awful anticipatory grief that we're stumbling on, this entire journey. And then it's the ambiguous loss. So it's those two combined that make it really hard to navigate this. Ambiguous loss. So there's two kinds of ambiguous loss. Like there's the ambiguous loss where like someone is prisoner of war or kidnapped. So they are physically not present, but they are emotionally, cognitively very present, right? Um, that's not the type of ambiguous loss I'm referring to. It's the second type, which is our person is physically present. Very clearly, they are physically here, but our person is not always the same person that they used to be. Our person is not cognitively, emotionally, mentally the way that we used to be. And that is an ambiguous loss that is so hard for spouses. Um, It's
How do you
just
help them navigate that? I mean, I know we talked about the breathing, we talked about exercise and maintaining your hobbies, but how do you take such a heavy emotion and help someone feel better? How do you do that?
giving them a safe space that does not bring judgment and allows them to express how they're feeling. And then just defining those two terms to them is really helpful to start. Like in the first session, just going over kind of what I've gone over with you can be really helpful because then we can start to recognize our grief. We don't know it necessarily, but we're feeling really messy, you know? And those stages of grief, right? Denial, denying, do they really have this, right? Bargaining. Well, maybe if I keep my loved one exercising and, put them on the keto diet, and, enrich them in all these activities, my loved one won't progress, right? It's this bargaining tool. And that is where self care becomes jeopardized because maybe if I give up myself for them, this slows down or this gets better.
I
So,
saw that so many times. It's so strange you're saying that. It's so
and
strange.
that
Yes.
has to be called out by a professional in most cases. Um, Going back to those things, not to say to a caregiver, saying things like, you've got to make time for yourself, or don't forget about your self care. I just wouldn't recommend saying that, right? Like, it's really hard. It's not that they don't want to do that, they just don't know how. So, trying to bring what might be self care to a friend, scheduling them for a massage, hanging out with their spouse or going for a walk with their spouse, um, keeping them up with exercise. Maybe you're a yoga buddy with them, keep them going. We all exercise better when we got a buddy who's also going, right? Just try to keep the self care in that way. Um, that can
Or
be really,
maybe I could offer, I mean, if you feel comfortable, if I were to say, I would love to stay with him and I made you a massage. So it gives
yeah,
you, you don't have the pressure of who's going to stay with him if it's not so safe, because that's also, I'm sure, an immense concern is I'm afraid to leave him or her.
yeah,
So if you offer that and then let them go do something that's just an hour, for or an hour and a half, 2 hours for themselves, I think that's really helpful. You said too something about not giving recommendations to the caregiver. So what do you mean by that? When you're saying you're giving them a safe space to listen, vent, and it's really not helpful to give recommendations. What do you mean specifically? What type of
yeah.
recommendations?
And I know that sounds like a broad statement, right? So there could be, certain recommendations that could be helpful. But a caregiver going through this doesn't need a dumping of, well, my friend's mom had this and, she did really good in adult daycare, or when my mom had this and maybe this friend's mom was 85 and has dementia, and the person they're talking to is 65 and has dementia. That is a huge gap in our life transition. And what worked for mom at 85 is not a cookie cutter approach for someone who's 65. So, like, recommendations just start to get messy. And whenever everyone wants to help, and when we want to help, we do like to recommend, I feel like. And when we do that, we don't give space to allow the caregiver, for us to listen to the caregiver. You know, we like, and if we see a caregiver really going through a lot and behaviorally their loved one has a lot of behavioral disturbance issues, lots of people around that caregiver are saying, how are you keeping them at home? Why aren't you placing them? Why aren't you hiring care to come in? That is really hard to hear,
Well, I
and
think and you don't know too, I think what's interesting is you don't know their financial situation. You don't
that's
know
the other
their,
part, Amy.
yeah,
I mean,
you,
let's talk about care. How
yeah.
much does care cost? Well, Lots of times it's assisted living that we're talking about, and an assisted living that has, levels of care, right? Independent living, assisted living. There's even a term transitional living now, which is like 12 hours a day of care, and then memory care, right? Well, how much does that cost? I even, it's bothersome when physicians will say to a caregiver, right? Because this is not just our friends bringing recommendations, it's physicians. You really need to put him in a facility. I think it's time. Well, has the question been asked in terms of finances if they can afford, if it's memory care, 8 to 11,000 a month?
Try a private caregiver. I mean, home care and a non-medical home care is about 25,000 a month for
20.
one-on-one care. So it is something that we all should be mindful of when you are thinking you're trying to be helpful and you're saying recommendations to someone. You really, number one, don't know what it feels like to be in their shoes.
Yeah.
You don't know what stage of grief, like you're saying, that they're going through. You don't know their financial situation, and you don't know emotionally if they're ready to say, okay, yes, I am open to a facility or having a stranger come into my home. I mean, those are very difficult decisions. And so I understand what you're saying of just not, you're saying just be a better listener. Let
Yes.
them just say what they want to say. Don't judge. Don't try to solve it because you can't solve it for them. And be a just listen.
Yes. And when caregivers come to us, they are often saying, everyone around me keeps saying, he seems so good. He's engaging in conversation so well. I can't even tell he has this. I wouldn't even know he has this if you wouldn't have told me. Caregivers do not want to hear that. It's not validating the difficult situation that they're in when we say that. And I know that others feel like it's a compliment. Like, we don't see that there's a disorder. We don't see that there's a disease. We don't, but caregivers need to understand that they're validated and that what they're dealing with is difficult. And so it's really hard. And this comes up early on when caregivers come to us. Like, no one understands what I'm going through. And then here's the other part to this, Amy, is that children grieve differently than spouses. So lots of times children sit in denial for a very long period of time, which means they're denying the mother or father, who's the caregiver, on whether or not this is that challenging. Sometimes, not all the time, but a lot of times it is that, right? And they're bringing judgment to how the caregiver is communicating, um, organizing, planning, and implementing the day for the loved one, right?
I've seen this so many times.
So
Also,
having the caregiver come to us and be able to talk about that, and for us to say, you know what, as we're talking about grief, your whole family's grieving. And everyone goes through this differently. When I say to caregivers, children often are in denial, a lot longer, it's like this light comes on. They feel a sense of relief, like, oh, you know, um, it's just
not
recognized.
feeling like they're alone, like that they're like, I thought it was just me, the way that my daughter's acting right now. And,
It
so how do
feels
you help them with these? Those are difficult family dynamics. So not only are you juggling, I'm now in this caregiver role, and then you've got your children that might not believe everything you're saying because not because they don't trust you, but it's because they're in denial. They're in a different stage. So how do you recommend that people can navigate those difficult family dynamics?
it's counseling, ongoing counseling, right? Um, Knowing that you have this upcoming appointment to kind of talk about the discord that's happened over the past week or two is really helpful. I mean, that's what counseling is, right? We experience a life stressor and we don't know what to do with it. And we first need to just talk about it. And then we need to have some strategies on, how to work through that, right? And I mean, counseling prepares us in that way. And caregivers really need that. And they're feeling isolated because no one's on their side, is how that feels, even though everyone's trying to be there. And I'm not trying to make light of this and everyone trying to help and offer advice. And I don't want to make someone who, is kind of that outside ring to this, like a friend, a neighbor, feel scared that they're going to say the wrong thing. I don't want to do that in this conversation. Um, I don't want to make someone feel like that. It's more of just being there consistently and thinking about how to be a good listener, just those two things. And to not give up on the friend, right? Not give up on the friend who is now the third time canceling on pickleball. I
There's a
think she'll
reason.
come.
Yeah.
I think she will come. She just, kind of has to get there. So I would, kind of keep, mentioning that when you can, and to keep reaching out and not to worry about, well, maybe now's not a good time to reach out. Let them tell you that. Don't assume that now's not a good time, or, that, well, my friend Sally must have a lot on her plate with her, husband Ralph, who, is in this dementia. I'll let her call me instead. Don't do that. It takes reciprocity in a friendship, and texting and phone calls is how we get that reciprocity. And we have got to give a longer rope to the caregiver, that they can like not respond to us a bit more frequently than another friend who's not going through this. We just
Give
got to
them
give
some
them some slack.
grace,
Yeah.
a lot of grace. So
Yes.
is it bad if I don't want to say bad, but is it not helpful if I texted, what can I do to help? Is that just too general, too open?
Not necessarily. And I think initially, like those are words that, we go to. And so I don't want to be like that that's bad, because it feels hard to not say that. I think what I would like to do is encourage those outside of the family, that are trying to help, is if you're going to make these statements like, let me know what I can do to help, or how can I help, to give some recommendations on what that might be, so that you're not putting it on the caregiver to come up with that, because they also don't want to feel like a burden, or to feel like they're interrupting your day, or feel like, well, you're working full time, how dare me ask you to, go grab lunch for us, right? But if you suggested, or you even push it just a little bit more. Hey, I, found this great pie at Just Pies, grabbed one for you too, dropping it off. I can leave it at the door, or I can come in, right? Do you see how you kind of give a variety of options and recommendations?
Yes.
That's what's most helpful. It's
Talk.
okay to say
Yeah.
something that doesn't fit into what I'm saying, but work with yourself as that good friend to get to some of the depth of what I'm recommending.
Well, you just did an amazing job of helping us understand what they're going through, which is just, I don't even think you could describe it, clearly in a couple sentences, because the emotions are all over the place. So it just helps you understand that. I think one of the worst things is just acting like, oh, I'm not going to reach out because I know their hands are so full. It's going to be uncomfortable for you too, but know that they need us right now. They need to know they're not alone, and they need to know that, even if it's something small, like you said, just, I'm going to the grocery. Hey, what do you need? Because I'm going to be driving right by, you know, anything you're out of that I can drop off for you. So you're more proposing something that might provide a little bit of oxygen to them, just in that day. You don't know what their day is going like. Maybe it's a good one, maybe it's not, but let's figure out something small that we can do to just say, I want to give her a little, or him a little bit of, um, like, it is oxygen. It really is oxygen. Like, just to have a little bit more breathing room on what they're juggling.
And then, instead of bringing recommendations, which, there's some that could fit within that, and instead of it is bringing judgment. So we flip it, is what I recommend others to do. And instead say, I know you're doing everything you can to make sure your loved one is safe and comfortable and well cared for. I see how hard you are working at this. To say things like, maybe you understand what they're going through because you've been through it yourself. If you don't, recognizing by saying that sounds really difficult, just say it because it is, you
It
know.
sucks. Like you said, it does suck. Like there's no other way to say it. And you're right. If you could just, you're validating how they feel and you're not trying to
And
fix it because you can't.
absolutely. You can do research for your friend. You could say, it sounds like you're thinking about if you should bring care in the home. Would it help if I narrowed down, went online, and did some research on a few home health care agencies, their reviews, messaged a few other of my friends who have gone through this to see who they used, um, or the Alzheimer's Association, right? The Alzheimer's Association is a big resource. There is so much online. You could look up, ways to communicate with your loved one. You could look up legal planning, financial planning. You could look up, even there's medications. You could even look at like the medications part, right? There's just lots of different categories. alz.org, and that is, nationwide. And then you can narrow that down to the local Alzheimer's Association chapter in your community. That can be a big resource. That can be a big resource for friends to go to for their friend. And to
I
kind of dig through that, caregiver support groups are tremendous.
I was just going to ask you about the support groups because what I found interesting, and I mean, I would imagine you've heard the same thing, is when I would encourage, a spouse to attend a support group, regardless of what their spouse had, whether it was Parkinson's, whether it was ALS, whether it was dementia, we would encourage them to do that just to have a little bit of time for themselves. And I was surprised at how many of them said, that's not for me. I don't need to do that. So why are they saying that?
Well, how many of us have done any group therapy? Okay, so that's going to be a small percent, right? If we do not have a history of our own, mental illness diagnosis, depression, anxiety, bipolar, whatever this be, the world of group therapy, group support, um, it feels very abstract. A lot of times the word like AA, right? Support group, AA, someone maybe has gone through that, Al Anon, right? And either they felt like that worked for them or they felt like it didn't, or they associate it with that type of group. They don't really want to be on the spot to talk about, they think this initially. They don't want to initially be on the spot to talk about what they're going through with everyone there, right? But yet when they come and they do that, it is so healing. It moves us through the grief stages faster than we could ever do as a counseling practice, really. And if our caregivers are in a caregiver support group combined with individual psychotherapy, to navigate this, life stressor that they're going through, it is the most efficient, most effective, most meaningful thing we can do for ourselves as a caregiver.
So that sounds like another recommendation of something I could do if I'm on the outside. If I find the local support groups, I know where they
Absolutely.
are, know what day it is, know what time it is, and I say to my friend or my mom or my dad, "Hey, I'm going to come over. I'm going to stay. You're going to go." And, it's just an hour. Go give it a try, see how it is.
Yes.
That's
Or you offer as a friend to go with them,
okay.
or you offer as a daughter. I love having children at the support group that I facilitate. It is so helpful because it immediately provides insight into what they might be saying that's judging mom or dad. they hear it around the entire table. There's anywhere from 8 to 15 that attend the group that I facilitate, and when they hear 15 caregivers say the same thing they've heard their mom say, it sticks. It's really helpful.
That's interesting, because I was wondering if the mother or father would be hesitant to have the child present in that situation. Are they typically welcoming of it?
It depends on the person and the family dynamics, right? I mean, all of our families have discord at some point. There's a long history of this, right? You open up any of our lives on paper and look at our families, there's a history of discord with all of us.
Mm-hmm.
And getting a dementia diagnosis is like a boulder that drops in the middle of the family and it ripples. It's a ripple effect in through all of the family. And gosh, it digs at familial wounds, right? Any of these past wounds that the family's gone through, certain things that the spouse might have said to the other one, right? I mean, marriage is hard too. Like, let's just admit that. Relationships are hard, marriage is hard. And I know for me and my spouse, just the look on the face could bring a comment, from him that then I don't want to hear, right? So we just do this to each other. Well, even when we're diagnosed with dementia, we still have this rote behavior, these rote responses, and our caregiver, our loved one, our spouse is looking more and more stressed, and we pick up on that. So we say these things. Or like mothers saying to the daughter, like, I think in terms of that counseling capacity and working with older adults, and then when we have this dementia diagnosis, is that families are bringing their entire history to us. We cannot assume that mom and daughter had a good relationship all their life. Just cannot do that. So maybe mom herself is bipolar. Maybe mom herself, has untreated depression all her life and said things to the daughter like, why are you, an artist? You're never going to make anything of yourselves. Just these digs, right? Well, even when we're diagnosed with dementia, we can still go to those digs. We just can. And that's where it gets really hard, that ambiguous loss. Is our person here? Is our person not here? Because it looks like today my mom can fire up and comment back to me the way she's done all my life. Yet, how is it that she's not remembering her meds when I call her on the phone to take them? Which is it that our person is?
Oh, I think too, unfortunately, some of that behavior can get exacerbated with dementia, where it gets even worse, and it's part of the disease. And I mean, that leads me to ask you, y- obviously, when you've worked in this industry for this long, you have so much knowledge and understanding how to communicate with somebody with dementia. You understand it. You're also, you're not only are you helping families process this diagnosis, but I would assume you're also helping them understand this disease, because
Absolutely.
that, yeah, that's challenging in itself. When at least what I saw a lot of that was really hard for me is the spouse would say, I just told you this,
Yep.
don't you remember I just said
Oh,
this? And those are some of the worst things that you could say to someone, but you don't know that because you don't understand the disease. So how are you helping these families understand the disease?
yeah. And obviously, this is challenging to get all of this out in like an hour episode that we're in right now, right? So when I'm trying to summarize, you know, we often have caregivers that come to see us and have been with us for a year or two, right? It's a long time, it's a long process. Um, it's not just kind of one initial consultation and you're done, right? Although for some families, just kicking it off that way and then giving them space to reach back out and come back to see us, that naturally can happen. And families need space to process that. But in addition to that, those communication strategies, and behavioral intervention, right? Those can be huge for caregivers. And we go over that too. I always say to caregivers, to try to avoid the 3 C's. Don't critique, don't confront, don't contradict. Now, that's, can be difficult for us to do as human beings because we tend to go there with those people that we're safe in going there with. But catching ourselves or having insight into, wait, I actually just critiqued him. Or wait, I just actually said, why don't you remember this, right? Wait a minute. Or he's saying, well, I just went to the doctor, last week when really it was, last year or something, right? Like that concept of time gets very blurred. And I think that's really hard for caregivers to kind of see that in someone with dementia. Or they might say, now, when is my doctor's appointment? And the doctor's appointment might be in 10 days. And now every day, several times a day, you're hearing, when is my doctor's appointment, right? I just told you when your doctor's appointment was. Or it could be even, let's say dad, our spouse, our husband has dementia, and he is talking to his daughter and says, well, I just went to the doctor and they said this. And let's say it's wrong. Like what they're saying is not accurate. And then the wife, right, or the spouse, whoever the partner is, will quickly correct that. And I always say, is that helpful, right? Like if you're in a doctor setting and the doctor's asking history, it is important to be accurate. So there is a time and place where correcting can be important. But there's other times, and a lot of times, where correcting is not necessarily helpful. If they say, the year is 2020 and it's 2025, or let's just exaggerate this a little bit in someone that's more moderate or even advanced, and they say it's 1950. If that feels comfortable for them to say, and they enjoy telling stories, and we all enjoy being accurate, right? I am like more gregarious and outgoing, more extroverted. My husband's more introverted. So when I tell a story or something my family's been through, like with other family, he would probably say I exaggerate a little bit, but like I get into the storytelling. And sometimes he'll correct me. I don't like that. I don't like it when he does that, right? Like it
Ditto.
doesn't matter. It doesn't matter if it took me 2 hours or an hour. Like really, like the point is that this task should have taken 2 minutes and it took 2 hours, but to him it was an hour, right? So this is where like, even for someone with dementia, we don't want to feel critiqued. And what helps someone with dementia is to just story tell. They're using their language, they're planning like their next word, they're thinking about how they're going to build the story. Like it takes a lot to say a story, right? Like, and that is enrichment for our loved one. It really is. I love hearing their stories, the car, and a lot of times there's accuracy. It's just not the right time or the right place or something's wrong. The 1957 Chevy that they used to have, and I'll even have them like bring in a picture of it, right? Like then there's the daughter who wants to say, Dad, you haven't had that car for 50 years. Why?
Who
It's okay.
cares?
It's okay.
Who cares, right? Just I think I heard the advice years ago, which I thought was great, is enter their world. Stop trying to bring them to ours because that's the correcting, like you're saying. If you're going to constantly correct and say, no, it's actually this year and it's actually this month. And what is that doing other than probably making them feel pretty bad because you're correcting them? No, I don't like to be corrected, just like you're saying. So if we can try to limit doing that, I think that's very helpful advice.
And if we limit doing that, Amy, guess what? We actually can find a moment of joy with our loved one. We hear something about our dad that maybe we didn't know because in his, long-term memory, he can pull from that well. But short-term memory recall is gone, right? And
Mhm.
if we just listen, we might get some wisdom. We might get some information we didn't actually have. And now we've got this moment of joy So instead of trying to pick out what's compromised and test our loved one, just take a step back to be in the moment with them so that we don't miss the moments of joy along this difficult journey.
So you mentioned the book Finding Moments of Joy. Are there any other books too that you would recommend?
Yeah, that 36-hour caregiver book is helpful for someone who is just starting this journey as a caregiver. For anyone that's been in this journey 6 months, if I have to say, or longer, that book might not have a lot of information. So it's kind of like depending the stage, the book might align better. Um, Travelers to Unimaginable Lands by Dasha Kipper. I hope I'm saying her name right. And then that one in particular, I love because it highlights those old family wounds that dementia can dig at. And it shows the way that the caregiver can actually experience, some cognitive distortion themselves because they're used to their person, they're being here, right? Like they're used to. And so if they're saying these things, isn't their person still here, right? Um, that book's great. It's a lot of different chapters are interviewed by people who have been in a caregiver role, either as a paid caregiver or just a caregiver themselves. So it takes you through different experiences and different journeys and helps to just like point out those different ways of communicating.
I'm definitely going to check that one out. I'm going
Yeah,
to check
that's a
out
good
both of
one.
them. They sound
I'm
great.
Still Here is a good one. That is um, that is written by, I think he was an architect, and he actually, maybe not an architect, but he was instrumental in building some specific memory care facilities. And I'm Still Here is really good to understand the sensory issues that someone with dementia is dealing with. Um, so the way that, yeah, that's a good book too, because it helps to understand that, 80% of behaviors are triggered by the environment. So how do we change the environment to help decrease behaviors? And that book takes us through the way in like a memory care environment that behaviors can be, if we change the environment, behaviors can be minimized, which I like to reference that even when some patients are in their homes, because we can model some of that and it works in the homes too. So that's a really good one. Learning to Speak Alzheimer's, that's a good one as well. Of course, if it's FTD, frontal temporal dementia, Emma Willis's book, The Unexpected Journey, that's specific to frontal temporal dementia. The other thing too, in terms of dementia caregiver support groups, is that it doesn't necessarily matter the type of dementia. You could go to any group, but some communities do have specific FTD, frontal temporal dementia groups, or Lewy body dementia groups. And, try a few out to find your fit. If you go to one and it doesn't feel like a fit, sometimes it's based on the facilitator too. They're all volunteers and we all come from all different backgrounds. And so if you're looking for a specific way for the group to be facilitated, try a few out. And then you can get more narrow in terms of an FTD or a Lewy body group if that's what your loved one's diagnosed with.
That's really helpful. The one thing too I wanted to ask before we would wrap up is you mentioned, I noticed sometimes people have LSW as a licensed social worker, but you said it's really important to look for the LISW
Yeah.
because of insurance. So what do you mean? Can you explain the difference between that? If someone's looking for a counselor and they are looking for something that might be covered by insurance, why
Yeah.
does that matter?
So the I is licensed independent social worker, which means under Medicare guidelines, we are part of that reimbursement package for different CPT codes. LSW and this is different levels of testing in terms of if you're LSW or LISW. A lot of times LSW could be that you have a bachelor's in social work. It could also be that you have a master's in social work and you never tested for the LISW. But insurance recognizes the LISW. The other term is LPCC, licensed practical clinical counselor. There are LPCs and then LPCCs. So the CCs and the LASW, LPCCs are what's part of, like, our practice is contracted with Medicare, for example. That is, those are two specialties that are recognized, that Medicare will pay for that. I like LISWs, that social work part, because it typically means someone comes from more of a resource background, resource capacity, maybe some case management, just different areas in which they may have practiced, might have been in a nursing home. It doesn't have to be an LISW, but for a caregiver to seek out and find counseling, I recognize that in terms of my practice, it is challenging to find caregiver counseling. If you go on Psychology Today, which is national, you can put in your zip code. You could even check mark your insurance. And then you can narrow down, if you type in the term caregiver counseling, or you type in the term aging, those two might get you to counselors that have more of a background in working with caregivers, working with aging transitions, and could help support this. Our practice does provide, cover all of Ohio. Licensed independent social workers are licensed specific by state. So at this point in time, we cannot provide individual psychotherapy outside of the state of Ohio. However, there is an interstate compact, and that interstate compact is for social workers as well as licensed practical clinical counselors. It expands opportunities for social workers to provide those services in a interstate compact, which I think it might be 29 states. Ohio is part of it. And in 2026 is when those policies, procedures, implementation rules are going to be implemented, which then will give persons like me the ability to apply for that interstate compact. Because right now, Amy, we have caregivers reaching out to us from California, New Mexico, Nevada, West Virginia, Arizona, Georgia, New Jersey, New York. And it's usually this dire, desperation of, what do I do now? My loved one just had this diagnosis. The word caregivers is in our practice name, right? Compassionate counseling for caregivers. And we come up pretty quickly. There's not a whole lot of practices that come up when you type in the word caregiver. When you type in the word aging or over the age of 65, there are more. So it takes the community, the medical system. We're all growing as this diagnosis gets more and more awareness. So we're at the start of this and recognizing the caregiver's stress. Studies are indicating that a caregiver's life could be shortened by 2 years due to the degree of stress. And that's something that, like, here in town, a few geriatricians have referenced to some of our caregivers. So the recognition is starting to be there. The awareness is starting to be there. And I do hope, and my vision is that will continue. I do hope to have a practice that reaches beyond the states of, the border of Ohio, to be able to help caregivers navigate this.
When you're saying families are contacting you and you can't help them, are you saying the best thing to do would be to go to Psychology Today and enter your zip code and enter those words of aging to try to find a resource that could support you?
Yes, absolutely. And when families do reach out from us to other states, I am sharing with them exactly what I shared with you, as well as the Alzheimer's Association. So for the state of Ohio, if someone calls in, they can provide counselors that specialize in this.
Okay.
So that could be a start too.
I'm going to put all of these, the book recommendations, the website, in the podcast show notes so that people have some resources available to them where they could find someone. But I would love to have another conversation with you because I feel like we just started in this very deep, heavy conversation. But everything you just shared was phenomenal, and I really admire the work that you're doing. I know that it's I love the story that you told, even about how you saw this was such a gap in the care and that you created something that's been a resource for people that desperately need it. And I'm sure that I'm sure you've touched the lives of a lot of the people that you get to work with, and just being that, it's a safe space. It's an absolute safe space that you understand what they're going through. You can validate it because you've worked in the industry for so long. And I just, I wish there were a lot more of you, because you're right. It's desperately needed. We did a hospice episode, and they said that their hospice patients now, it's like 70 to 75% have some form of dementia. So this isn't going anywhere. And we need to support these people that are not only diagnosed, but the people that are caring for them. So I just hope that God continues to bless your work, because what you're doing is so needed. And I hope that we can have another conversation again, because I think there's a lot more we can learn.
I agree, Amy, and I'm just so thrilled that you invited me to be, part of your show today. I really am, and I want to reach, out to all those pockets and all those areas to be as helpful as possible, and to find more counselors that want to specialize in this. Please, reach out if anyone out there is wanting to do this, trying to figure out how to do this, already doing this, wants to collaborate. I'm starting to do some of that in other parts of the community and other areas, those that really have an interest in working with someone with dementia, which sometimes that's more of like someone specializes in geriatrics. But as we know today, I mean, our youngest client is 52 years old, right? So it's getting younger, and there's a lot different dynamics, with those different ages too. But for the most part, just having that compassion to be able to work with families has been a huge reward, and it makes the difference. It makes the difference, or I wouldn't be doing this.
We'll so appreciate the time. We'll schedule another one. Please, for listeners, leave a comment, leave a review. This episode was incredibly helpful, and share it with someone that you know really needs to hear it. So thank you so much, Amy. We'll talk soon.
All right. Thanks, Amy.
That's a wrap for today's episode of The Care Table. Thank you so much for joining me. If you found this information helpful, would you like, subscribe, write a review, or share this episode with someone that you feel could benefit from hearing this information? I'd sure appreciate it. If you learned of anything during this podcast as far as books, resources, or products that you might think are helpful, be sure to check out the podcast show notes for links to access that information. A friendly reminder that this is not medical or legal advice. This is just information. Consult a professional for your own personal situation. I ask that God would bless you with the wisdom, the courage, and the strength that you need as you're navigating this caregiving journey. And I want to remind you, you are not alone. I appreciate you joining us today. And until next time, stay strong, and I hope to see you at the Care Table.